name is Lisa Berkey. I'm the Executive Director of the Greater West Bloomfield Community Coalition, and I am here today with Dr. Darren Lubbers. Darren, can you tell us a little bit about yourself?
Certainly, and thanks for having me here today. My name is Dr. Darren Lubbers, and I earned my undergraduate degree at the University of Michigan, did my graduate work in psychology at Wayne State, both master's and PhD. I've been working with coalitions for many years in the state of Michigan and some work in Minnesota and other parts of the country. I've always been very involved with behavioral health and helping to prevent substance use.
Well, we appreciate all your help. We're here today to talk about the MiPHY Survey. So Dr. Lubbers, can you please tell us a little bit about the survey?
Certainly. The MiPHY Survey is a statewide Michigan survey. Excellent survey, covers many topics such as adolescent substance use. It covers mental health, family, school, all sorts of areas of concern and risk factors and protective factors for our youth.
Great. When was the MiPHY given here in West Bloomfield, and who took the survey?
It was taken by 7th graders, 9th graders, and 11th graders, and the survey was really comprised of a large sample from all of those given grades, and it was in 2017 and 18 that the survey was conducted.
Wonderful. And how do we know the students are answering these questions truthfully?
Well, one thing that's very important is that the students are informed that it's anonymous, so they know that their answers are not going to come back and be detected to however they answered them. The other real positive is the cleaning methodology that the state of Michigan utilizes. What they do is they use a technique called inconsistent responders, and what that means is if a student, for example, said that they've never smoked cigarettes, yet later in the survey they indicate that they had smoked cigarettes in the past 30 days, those particular responses would be removed. So it really helps with the cleaning methodology to eliminate inconsistent responders and make sure that the data is valid.
Dr. Lubbers, can we start with some of our 30-day use numbers?
Absolutely. One of the important indicators that we look at in the MiPHY is the percentage of students who had at least one drink of alcohol in the past 30 days. Some of the good news in terms of the West Bloomfield numbers is we're substantially below the county averages. For example, our ninth graders reported 6.5%. Meaning the majority, of course, did not drink in the past 30 days. And you contrast that with the county average ninth graders at 12.3%. Quite a substantial difference there. Our 11th graders, which you'd expect to have experimented with alcohol a bit more than our ninth graders, were still substantially below the county average. For example, our 11th graders, we had 16.4% indicating that they had drank alcohol on one or more occasions in the past 30 days, and the county average was almost 30% at 29.2. So very good numbers for the West Bloomfield students.
Definitely. And what about for marijuana?
With our marijuana use, we're also quite below the county. Our ninth graders, 7.5% reported smoking marijuana in the past 30 days. 7.2%. And the ninth graders at the county, it was 10.6%. So substantially below.
Definitely.
Our 11th graders, 16.1% compared to the county at 25.1%. So overall, when you look at our marijuana numbers, they are below the county averages.
Wonderful. And what about for prescription drugs?
Prescription drugs is an area of concern not only in Oakland County, but nationally. The good news to report there is experimentation with prescription drugs is still below in West Bloomfield. We had 4.6% of our ninth graders report they had used prescription drugs without a doctor's order, compared to 5% for the county. So just, slightly below, but below. Our 11th graders were at 3.5% compared to the county at 7.6%.
Let's look at vaping and tobacco.
Well, Good news there as well. When you look at smoking in West Bloomfield for our youth, we're very low. Our ninth graders are at 1.6%, so very few ninth graders reporting past 30-day use smoking, 2% at the county level. Our 11th graders are at 2.2% compared to 4.6% for the county, so our numbers are quite impressive. And that's one of the things that is just so important to keep those numbers low. It's such a health concern with smoking in our youth, a lifelong battle that many people encounter. When it comes to vaping, that's a different issue though. I mean, those numbers are increasing across the nation. It is one of our big public health concerns. We are below the county. Okay, we're at 15.7% for our ninth graders compared to 22.7% countywide. Our 11th graders at 20.6%. The 11th graders at the county are at 35.5%. So vaping is a huge area of concern that I have. I think we need to stay very vigilant to keep an eye on those numbers. I mean, we're below the county averages, yet I'm concerned about those numbers.
We are too at the coalition, and those numbers are from February of 2018, so they could be even more different right now.
Oh, absolutely.
Why do you believe our West Bloomfield numbers are lower than Oakland County?
Well, I think one of the major strengths of West Bloomfield has to do with some of the early prevention programs. For example, we have what's called the KICK program, or Kids in Charge, which is an elementary school-based program. That program teaches our youth all sorts of great educational facts regarding substances, helps them with perceptions, refusal skills. It's really that early educational foundation that I think has some real positive effects.
Yes, Kids in Charge has been around here in West Bloomfield for 30 years.
It's impressive.
And we are reworking the curriculum right now, and we have definitely added all the new issues like vaping into it, and because marijuana has been legalized, and we've added refusal skills as well as coping skills. So I'm really excited about the Kids in Charge program. We also bring other programs to help with the 30-day use. We bring programs into the middle school and the high school. We'll bring programming in on the dangers of vaping to our sixth graders, and we'll bring it in also for our parents. We also bring in recovering addicts to tell about their battle with addiction and how it started and what their mistakes were. And then talk about how hard it was to become clean and how hard it is to maintain that as well. Could you expand just a bit on vaping? I know it's a big national concern, especially since we've had nationally, they announced the first death due to vaping.
Yes, I'd be happy to expand on the vaping concern. One of the interesting facts that just came out was from the University of Michigan. They track national substance use among our youth. They've been doing this since the 1970s. They recently published a report indicating that vaping has the single largest increase in a one-year period of any substance ever recorded.
Wow.
Yeah, it is just a dramatic concern. I think what's happening, and we're working on an article regarding this right now with some work that we've done in Minnesota, where what we really found was that low perception of harm is a huge predictor. In other words, I think that you think that vaping is just an okay thing to do without any potential health ramifications. But to the contrary, what we're seeing is that a lot of kids initiate vaping and then kind of move into smoking, kind of calling them dual users. And so the health consequences of vaping in and of itself, but the potential of that moving towards smoking are of huge public health concern right now. It's a national issue. We're seeing this everywhere. And I really think it's important for educators, parents, schools to really get on board and let kids know about the potential health consequences of vaping, because the numbers are alarming nationally. And as you saw, we have quite a few kids in West Bloomfield vaping as well. I mean, once again, we're below the county numbers, but we still have a fair share of kids that have initiated vaping.
Definitely. I know our kids think nothing's going to happen to them, but when they're inhaling chemicals
Yes.
that we know about that are not supposed to go into their lungs, it's still dangerous. So they're being human guinea pigs.
They absolutely are.
Yes, and a lot of our parents don't necessarily know how small these devices are. So when we do have evening programs, I know it's beneficial for the parents to actually come and see what these vapes look like, touch them, and know what they should be looking for in their house as well.
Absolutely, very important.
So what do you think is going to happen with tobacco use? Are kids going to transition from vaping into smoking cigarettes? Is that a possibility?
That's a huge possibility. I mean, that's exactly what some of the research is pointing out. Vaping is quite expensive, and so kids often initiate with vaping. Obviously, there's nicotine in vaping, and there's that transition that many kids have where they become those dual users of both cigarettes and vaping products. And it can kind of create a kind of a lifelong battle. And so vaping was initially created to help quit smoking, but ironically, many kids are starting smoking because of vaping.
Wow. Definitely something for us to keep concentrating on
Absolutely.
with our students and our parents. Let's move on. Can you tell us a little bit about our youth's perception of harm when it comes to alcohol, tobacco, marijuana, and prescription drugs?
Absolutely. And when you look at percentage of harm data points, really what you want to see is high perceptions of harm, meaning that they feel that using a particular substance could be harmful for them to take that particular substance, like marijuana or alcohol. So the higher those percentages, the less likely you see kids actually using. Okay, so for example, our West Bloomfield numbers, when you look at binge drinking, which is a concern area when it comes to drinking alcohol, because in essence what that means is a kid would be drinking 4 or 5 drinks within a 2-hour period, which is of course highly risky.
Yeah.
So in our 9th graders, we have almost 80%, 79.5%, indicating that they think that's harmful. Okay, and that is at a higher percentage than the county, which is a good thing. Once again, you want that perception of harm or great risk to be high. In terms of cigarettes, we have 83% of our 9th graders saying, hey, that would be very risky for me to smoke cigarettes. And you also, of course, see our 30-day use very low, which makes sense because they think it's risky. My biggest area of concern is marijuana. That perception of risk is very low. We only have 52% of our kids saying that they think it would be risky to smoke marijuana. Now, believe it or not, that's actually better than the county numbers, yet it's still a concerning number that a little over half of our kids think that's risky. Prescription drugs, much better there. We have 79% of our 9th graders saying that they believe that's risky.
Do you think we'll see a further decrease in perception of harm due to the legalization of marijuana?
We are seeing that pretty much across the board in the state of Michigan, and we're seeing that in West Bloomfield as well. It's certainly a concern area. You see that in states like Michigan where, you know, the laws have changed and kids then sort of perceive that it can't be risky, you know, because it's in all intensive purposes perceived to be absolutely a legal, therefore less harmful substance. In fact, when we do some of our federal reporting on substance use in Michigan, when we try to plug the numbers in, they think we're making an error, you know, because our numbers are absolutely so much different than the national numbers in terms of perceived perception of risk with marijuana. So yes, I think those numbers where they're at now are concerning. They'll probably even become lower, meaning less perception of risk, which is a concern.
Did we see our first decrease when it became legalized medically?
We absolutely did.
Okay.
And as the laws are changing, it's declining even more. Okay. So you're right on the money with that.
So we will definitely have to work on that as well as a coalition with prevention information on the dangers of marijuana.
Absolutely.
Let's move on now to cover what our kids think our parents are thinking about alcohol, tobacco, marijuana, and perception of drugs. It's very important to know what they think their parents think.
Yes. Well, I've got good news here, okay? When it comes to how the kids perceive their parents, disapproval, we have great numbers. Like, so for example, the percentage of students who reported their parents feeling that having 1 or 2 drinks nearly every day would be wrong, you have 97% of our 9th graders saying their parents would definitely think it's wrong for them to drink, okay? Which is better than the county average at 96%, or 96.1 to be exact. Our 11th graders even more so at 97.1 compared to the county at 94.9. So the kids are hearing some good messages from their parents in West Bloomfield. I mean, those are some great numbers.
Definitely. So that means our parents are talking to our kids
Yes.
and communicating about these very tough subjects.
Yeah, there's nothing ambiguous about the data. The kids know their parents would say, hey kid, no way you should be doing this.
Great. And what are the parents thinking about the other drugs?
Well, when it comes to cigarette use, it's very similar, okay? We have almost 97% of our 9th graders and 99% of our 11th graders know that their parents would think it is wrong for them to smoke cigarettes. So very clear messages that West Bloomfield youth are getting from their parents regarding cigarettes. What we don't have yet is a question about vaping, and that would be really good to understand the perception that kids would have in terms of disapproval from their parents to vape.
Right.
And I'm hoping that would be as high as cigarettes.
Yes. Let's hope that MiPHY would add that to
Yeah.
their survey as vaping is increasing.
Mm-hmm.
What are our parents thinking about prescription drugs?
Well, with prescription drugs, also good news. We're at 96.3% with our 9th graders and 98.7% with our 11th graders. So the kids certainly are getting the message from mom and dad that using prescription drugs inappropriately is a wrong thing to do. Absolutely.
Great. And I think last is marijuana. What are our parents thinking about that?
Well, we still have over 9 out of 10, or 91.2% of our 9th graders knowing that their parents think it's wrong for them to smoke marijuana. We have 91.3% of our 11th graders, so they're definitely hearing that message from their parents that their parents would disapprove of them using marijuana. So my thought on that is that kids are feeling this low perception of harm from other places, because it seems as if their parents are giving the kids the right message.
So that could be coming from their friends, the internet, advertisements on the radio, billboards. We're seeing all of that now with the legalization.
There's pervasive messaging that's coming at kids in different places, but from what our data is saying, the parents are getting the message out that they do not think it's a good, healthy thing for them to do in West Bloomfield.
Wonderful. So we have to keep reminding our parents to keep talking to their children about all these drugs and the dangers, and
Absolutely.
and maybe teaching them some healthy alternatives in coping.
That would be very helpful.
That's great. So let's move on to our mental health slides.
Okay, let's talk about mental health.
Let's take a look at our first slide for our 7th, 9th, and 11th graders that compares to Oakland County.
Well, one of the things that the MiPHY asks, it's a question that really relates to depression. And so what they really ask kids, if they felt sad or hopeless almost every day for 2 weeks in a row, that they stop doing their usual activities. And when you look at our 7th graders, we have 27.1% that are indicating that they have felt, sad or hopeless at some point in a 2-week period within the last, remember, it's a big point in time though, the last year. And when you look at that, that's a bit higher than the county average. So one of the areas of concern, and I know the coalition is focusing on this, but it is an area of concern that our numbers are higher when it comes to our 7th graders, our 9th graders, and our 11th graders in reporting those symptoms. Now, when you look at our 9th graders, we have 40.3% reporting that they felt that sadness or feeling hopeless. Our 11th graders were at 40.2%, which is very similar to the county average, but our ninth graders are quite a bit higher than the county average.
Yes, there's a lot of pressure on our youth these days.
Yeah, and I do think that, I just want to point out though, just answering this question does not mean that a kid is like clinically depressed, but what it does mean is that a parent, a teacher, you know, some sort of responsible adult would be able to help that kid with the resources to get a professional assessment if they're feeling these kinds of symptoms of depression, because there are very effective means for kids to get help.
Yes, and there's a definite difference between anxiety and depression, correct?
There's a definite difference. The two conditions are correlated. However, yes, there's differences between those two conditions.
Okay. Let's take a look at the next slide on our youth.
Okay, well, one of the other important areas that the MiPHY looks at is kids that have suicidal ideation. And this is, of course, a very serious concern that we all have regarding our kids reporting on that kind of thought process. And one of the questions is, have you ever seriously considered attempting suicide? We had 21.8% of our 7th graders indicating that they had considered suicide. Very concerning, right? We had 22.8% of our 9th graders, which is higher than the county average, and we had 23.1% of our 11th graders. So we definitely need to have parents and, you know, school personnel, professionals in the community, you know, being there for kids to be able to get the right kind of help when they're reaching out and saying that they have these kinds of concerns. A kind of a related question in the MiPHY is kids that have actually reported that they made a plan, which, because when you are saying that you're making a plan to commit suicide, that's actually a step above in a concern area. That means they're really thinking about it. And we had 14.3% of our 7th graders, 17.2% of our 9th graders, and 13.4% of our 11th graders indicate this. So having resources through the coalition, having parents aware, school personnel, so that we can talk to kids and get them the help that they need is something that we want available.
I'm a true believer of the village. It takes all of us to watch our youth. It may be the parents looking, it may be the school, it may be the coach, maybe the religious school. Everyone's got a different view on our youth, and everyone should be aware of what they're going through and be there to help. And we also hope that our kids feel comfortable, that they find that 1 or 2 trusted adults that they can speak to.
And that is absolutely perfect. I mean, you want coaches and administrators and teachers and parents and friends to be able to hear a kid if they're saying they have a concern and be able to get the help that they need. So that's great that you're thinking about it like the village.
So here at the Coalition, we've been reviewing these numbers for quite a while, and we've been coming up with ways for our youth to learn resiliency and coping skills. As I said earlier, we're redoing our Kids in Charge program, so our youngsters will be learning how to cope and learning methods, different types of meditation and yoga, anything to help them relax and be able to become resilient and manage their stress. We're also trying, at one school, we're going to try just specifically yoga with our K through 2. And at the middle school, we're going to be bringing in art therapy. At the high school, we've brought in meditation, and we're hoping to bring that back this year. But we're just trying to introduce a variety of coping mechanisms so the youth can pick which one they're comfortable with. And it's not something major. It's just a coping skill that makes you relax. It can be as easy as listening to music, taking a walk, petting the dog. Whatever that's healthy and makes you relax is a wonderful coping mechanism. And the earlier we can teach them that, the better.
And I think those are excellent services and options that you're making available for kids. There are a lot of stressors on kids these days. And so, you know, that's almost within that genre of called mindfulness techniques, you know, where it's that ability to, you know, find ways to relax and clear one's mind. And so I'm really happy to hear that you're offering all of those. I think that's wonderful.
Thank you. Well, our goal is to help kids grow to their greatest potential. So if we could help them prevent the drugs and alcohol, but also teach them the positive coping mechanism so they're not falling back on the unhealthy coping mechanism, that's what we're here to do.
That's excellent.
And we also want to help our parents be able to help their youth. So we will continue working on that. So the next time we look at these numbers, we'll hopefully see better numbers.
I hope so.
Well, thanks. Can you talk to us a little bit about some other factors that are important in our young people's lives?
Yeah, absolutely. You know, one of the things that you really hope to see is that kids are able to reach out. It's back to your village concept, but being able to reach out to a multitude of different resources in the community. And so one of the questions that we ask on the MiPHY survey is, hey, would you be able to reach out to your mom or dad about personal problems if you needed some help? And so the good news is we have 79.1% of our 7th graders, 74.5% of our 9th graders, and 72.1% our 11th graders saying, yes, I can reach out for mom and dad with personal problems when I need help. So clearly that's saying the majority of kids feel that they have, you know, mom or dad or both that they're able to reach out to with a personal problem.
That's
you know,
wonderful.
It really is, because you know how it is. It's like youth are sometimes reaching out to their friends, which is important too, but you know, there's a wisdom that mom and dad have that would be nice to be available for our youth. And the kids are saying that mom and dad are available.
That's great. They act like they don't need us, but they really do.
They do, they do. Well, and one of the other important indicators in terms of friends that we see is we look at a question in terms of, do you have a best friend who made a commitment to be drug-free in the past year? We have really good numbers there as well. We have almost 80%, 79.9% of our 7th graders, 70.1% of our 9th graders, and 67.4% of our 11th graders saying they do have a best friend who has made a commitment to be substance use free, which is a great thing in that, you know, that really doesn't have a place in terms of the future self for most kids when it comes to, you know, like being college bound or whatever kind of personal aspirations that they have. So you like to see friends hanging out with friends that have pro-social goals.
Definitely. We as parents have to watch for that as well. If our kids are hanging out with somebody that isn't like that, we may want to talk to our youth about that.
Absolutely.
And then they're reaching out lastly to our teachers, is that what I?
And it's another really important thing to see. Part of like a humanistic education model really relates to, hey, as a student, do I feel that I get one-on-one time with the teacher? Are they there for me? Not only for teaching me whatever, math or science or writing, but do I have one-on-one time with the teacher? So that perception of having available teachers is really critical in terms of student growth. And in our 7th graders, we have 66.1% saying they have lots of chances to talk to a teacher one-on-one. Even gets better as kids like kind of move through the educational system, with 70.6% of our 9th graders and 81.4% of our 11th graders feeling that they have that one-on-one time with their teachers. And that is absolutely huge. I mean, so teachers are extremely important in terms of that connectivity, that relationship, that there was a famous psychologist named Carl Rogers who talked about unconditional positive regard. So if a student has a relationship with the teacher where they know that teacher really cares about them as a person, that goes a long way for that student's future.
That's great. Well, we want to thank you so much for coming here today and going over these results. They're very important to the coalition as well as West Bloomfield School District. Once we receive these results, as you know, we review them with Dr. Hill and the principals, and then we decide what programming we should be doing for our youth as well as our parents. and we offer these results to our community because it's very important for our community to know this information as well. Excuse me. So as we wrap this up, I just want to remind people to go to our website, www.gwbcoalition.org, for the complete MiPHY summary so they can see all the results that Dr. Lubbers covered today. And we also have many resources there as well. And when on our site, please sign up for our informational emails. We will send out notifications about our upcoming events, as well as if there's any changes with drugs or alcohol prevention techniques. Thank you once again. I really appreciate your time.
Thanks for having me, Lisa.